Welcome to Airway Circle Radio.
This is episode 1 of Breathing and Beauty,
Beauty.
aka Badass Breathing Beauties. Just joking. We are your hosts. I'm Dr. Jennifer Hobson, and this is
Martha Cortés.
Today's podcast is going to be a little bit around how we started our relationship together as airway-centric providers. Martha, can you tell everybody what you do as an airway dentist, what type of work you do?
It's very innovative because it does treat airway. It does treat headaches, tinnitus, sleep disorder breathing, whether it's a child or an adult, sleep apnea. But what makes it innovative is we actually go to the root cause and we start reversing the symptoms, but then actually the medical condition, we work on reversing and treating that root. That's what makes it innovative. And you?
I am a physical therapist, a very head and neck trained physical therapist by my mentor, Dr. Mariano Roccabato. Coming from a postural background, I am also a myofunctional therapist. So I train the tongue to function properly, to swallow properly, to rest properly, so that we have healthy airways. On top of that, I do breathing retraining and do Utako breathing re-education to these patients that tend to have breathing problems.
So we are collaborating. We are collaborating. And actually, Dr. Jennifer, how did we meet? Was it New York City?
It was New York City. I think back in, oh my goodness,
I don't remember.
2014, I think it was. Roccabato was, Dr. Mariano Roccabato was there presenting, and I presented with him about the head and neck and the upper cervical spine. And you kept asking questions after questions after questions. Very, very thoughtful questions, but I think you were intrigued by the conversation.
Oh, are you kidding me? C1, C2 is my absolute favorite thing. I know I'm a dentist, but my upper cervical is my favorite. My master's thesis for the International College of Craniomandibular Orthopedics was based on if the position of C1, C2 is not correct, then you don't have the right bite. Doesn't matter if it's neuromuscular, doesn't matter if it's OBI, C1, C2, occiput actually has to be the right thing. And that's why it was Latina love at first sight. Because you and I are C1, C2, and I'm like, oh my God.
So you're a Latina, I'm a Latina, but we were talking a different language.
We were speaking Spanish a little bit, we touched, but it really wasn't it. The language that is common to you and me is the breathing language.
That's right. That's right. So it was really the AAPMD conference, the American Academy of Physiological Medicine and Dentistry. That's a mouthful, but that conference brought us together, and we started working together, slowly getting to know each other. And the work that you do, Martha, and I just feel like it wasn't until I started working with your son, right? That we really got to know each other more.
Yes, because it's really interesting because, through the mouths of children hear the truth. He's not a child, a baby, but the thing is he's mine, and I listen very much to what he says. And he says one day to me, because, Mom, you're doing all this myofunctional therapy, but you know what? Dr. Jennifer has it right. You got to start with breathing. It's breathing and myofunctional therapy and tongue training. You really can't do it if you're not breathing right. Why don't you both get together and do more with that?
That's right. That's right. So we've been kind of working together now for a few years around patients that you feel need not only the myofunctional therapy, because I think you've been working with myofunctional therapists for a long time, but it's really learning how the breathing. That's where I start with patients. I make sure that they nose breathe properly, but more than anything, that they don't overbreathe or fast breathe, or that they breathe through their chest and use all these terrible muscles that change head posture. And you know how we talked about the upper cervical spine? You can't have a proper CO, C1, C1, C2 position if you're chest or mouth breathing. That pulls your head forward. Just like Mariano Roccabato teaches, that it's a 50-50 concept, right? 50% craniomandibular, 50% cranial cervical. So they cannot work separately. They have to work hand in hand. And you were one of the dentists that really got this. So it was love at first sight, Latina love and breathing love.
But you got me on the breathing and the position of C2, because all I ever try to do is bring that lower jaw down and forward. Why? There's so much grinding. All these people have movement disorder because of the breathing disorder. My shoulders are imitating them. They have a tendency to use accessory muscles for breathing. But it was you that really, I started appreciating the C2, the sphincters around it, the inferior, middle, and superior. And then they were doing condylar distalization with all the grinding, finding their jaws. Once brought it down, how you need to get the head on top of the cervical. How are you going to do that? You got to release in there.
Right. So the position of the upper cervical spine is very much dependent on how we position our tongues, right? And we support our airways and make sure the tongue is supporting the back of our throat, so we don't go into this airway posture, which brings the jaw back and down. So the head and neck dictate kind of where this mandible floats and settles. So if their heads are forward and their tongues are down and they're clenched, they're going to dystalize and become more retrographic and become more like turtles, right? We don't want to be a turtle. We want to get our heads out of
our voice changes.
Yes. So this has been kind of a relationship where we've kind of learned from each other. We've seen patients together, and can you tell a little bit about these patients when they come to you and they tell you, okay, I've been working with Jennifer, the breathing, the myofunctional therapy, how has that changed things for what you're doing?
Well, first of all, the referral for breathing clinic, they go, I breathe. Look at me breathing. What are you talking about? Why do I need to be retrained for breathing? I'm alive. I'm breathing. I've been breathing since I was born. And you're like, well, no, there's certain kind of breathing. If you overbreathe, and Jennifer explained this a little more, but you're overbreathing, first of all, because of the medical condition that it can create, is that you can get tension. You can actually make your cardio vessels squeeze, and in squeezing them, you actually increase the blood pressure. So all I can view is that there's a breathing disorder developing, and now the blood pressure is going up as a medical condition. Who would ever think that the blood pressure goes up just because in breathing incorrectly, overbreathing, and then it's involving the CO2, right?
The CO2 is very much affected by overbreathing or breathing too much, really, either through your mouth or like even if your mouth is closed and you're breathing fast. And many of our patients that come in with airway problems are restricted in their airways. They've collapsed kind of in their own throats and noses because of years of improper breathing habits. But that overbreathing allows too much of that CO2 gas to get released, which actually causes a tension throughout your entire body around all the smooth muscles around your organs. They tighten up. All the tubing in your body tightens up. So people end up with cold hands and feet all the time. They're wondering why they're cold all the time. And the doctors don't necessarily say, oh, that's breathing related. It's kind of an unidentified problem. So you can go through all the systems of the body and how low CO2 can affect, but it puts more pressure on your heart. It causes more kind of IBS type issues with your digestion, and it makes you really tired. We all need our energy to be able to do what we're doing every day. So people tend to be chronically fatigued and tired. So if you just do dental, like your dental expansion and your airway treatments are amazing, but if you don't have the function of the body and the tongue placement and the breathing mechanics and the proper muscles, right? If you use only your neck to breathe, your chest is going to be up here and you're going to be like suffocating yourself, basically.
Yeah. And I thought all this time was, how they talk about the children's muscles being so weak, hypotensive, hypo something,
Tonic, hypotonic. Yep.
hypotonic, and I thought it was hypotonic adult. I never really, even though I did myofunctional therapy, I never got that. And in alternative medicine, when their arms are up, it's a fear emotion. So it was really interesting because all of a sudden, these things are coming together. There's more mechanics in it.
Oh yeah. Yeah. So the clenched tightness all the way up here, you said tinnitus, right? Well, what do you think tinnitus comes from over
Yeah.
time? If you're clench, and you're compressing that ear,
The middle ear.
and all these muscles are you're utilizing these muscles, there's a whole thoracic outlet that your arteries, veins, and nerves that come from your neck need to be properly, space around it so that everything functions right. So the breathing affects the way we sit, the way we move, the way we walk. And
Mm.
most importantly, our airway starts to be compromised. So Dr. Martha Cortes is an expert in all these different types of airway opening treatments. And me, Dr. Hobson, is from the Hobson Institute. I have a way of introducing these concepts. Function is kind of hard to change. Posture is so hard to change in people, right? But you have to have the right mental, approach to these patients so
Oh,
that
a lot.
they
I keep sending you young men and
difficult.
30 and 4-year-olds men that are much harder because they really don't want to do the things and they don't understand how much the soft tissue. They want me to expand them hard and move them, but if the soft tissue is not there, and if there's a lot of hypertrophy, only because they're breathing incorrectly. Oh, I have adults with tonsils in very small little areas where I really wanted them operated on, but why am I going to have them operate when they could breathe better? Open up the tonsils will shrink, expand, breathe better, and the adenoids area, it's going to shrink on these adults that we don't
Oh,
talk about.
my one of the reasons why I got into the field of myofunctional therapy, I'm one of the few PTs, and I hope to change that in our profession because PTs, we look at the whole body as a whole, but the head and neck TMJ PTs really understand the mechanics of how the jawbone connects to the neck. But it wasn't until my kids had swelling in their tonsils and adenoids that I realized, oh my goodness, this is a bigger problem. This is not an age thing. It's a human thing that we start to breathe improperly. But in my kids, we were able to close their mouth and retrain nasal breathing. And guess what? They did shrink away those tonsils and adenoids. So proper breathing habits can just start nudging the person into proper health if
And it was,
they're started early enough, right?
yeah, early enough, expand them early enough. But what I remember about your little ones is that one had allergies and the other one did not.
Right.
But they both had swollen tonsils. And yet, so it really didn't fulfill what an ENT would say
Yeah, the
is.
ENT said, "Oh," she said, "Okay, we can cut them out right away, no problem." I said, "No, no, 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 no. Let's talk
Why? The
about
question is
why
why?
they're there." And she goes, "Well, you know what? I don't really know. You should go get them allergy tested." And I was like, "Oh, okay." I did, and like you said, one was allergic to many things. He was my premature baby, and the other one was not allergic at all. So it wasn't just
It's not
that.
simple. It's not
And then
simple.
I didn't realize at the time that their mouths were open all day. My as a mother, you don't look at your children the same way as you look at all your patients. So it was right under my nose. I was missing that big picture. So yes, I am the focus of any patient that you send to the Hobson Institute is to shut their mouth first, to get them nose breathing, to shut their mouth and get their nose breathing, and then to slow down their breath.
The writer and the artist back in the 1800s, Catlin, was the first one who talked about shut your mouth, close your mouth, because he was among the American Indians, and the mothers always closed their mouth. It was the habit of all the society of the American Indian to close the mouth, and they didn't have breathing disorders really at that time.
No,
And
no,
so that's what he reflected on his time because breathing disorders were beginning to show because of the open mouth syndrome
right.
at that time. So it's really interesting. He has that little book with all the drawings of open mouth. and what to
Yeah.
do.
Yeah.
I found that
So
interesting.
it wasn't until your son and I met, were working together, that I found out that you were writing a book. I found out that you
Yes,
were writing a book,
yes,
right?
yes,
And the
yes.
book is on tongue
Miles,
tied.
actually, it's really, it started as in the beginning, our first struggle to breathe, the
Yeah,
first breath. And it's developed into more like the power of the tongue. In the beginning, we were all tongue tied,
tongue tied.
which is really, but now it's so important to realize that it's not just a tongue tie. There is an enzyme deficiency. There was a problem at the 6 to 12 week with the enzyme being deficient. But the question is, how are they swallowing? And by the fourth, 6 week, they actually take a breath in the
Yeah,
fetus. They take a 3-second breath, then they train. So by the ninth month, close to the ninth month, they actually come out, are able to take a big breath. They trained all that time. So there could be a lot of incorrect swallowing, incorrect breathing all that time that now is brought onto when they come onto the breathing earth.
right, right. So it was your son that said, "Okay, why don't we get Dr. Hobson involved in writing?" And I think when we started working together there, it just kind of solidified our relationship. And what I would love, I brought in a little bit of the breathing, a little bit of the myofunctional, a little bit of my background, all my I'm tongue tied. I grew up with, crowded teeth. They pulled my bicuspids just like many, many of us. My wisdom teeth too. I had eight healthy teeth pulled, and my kids were tongue tied. It was like a familial thing. So to me, when you asked me, I was so honored, and it means so much to me. Not that I feel like everybody needs a frenectomy. It's not
No, it's not
necessarily that.
simple. No,
It's not
and
that simple.
no, it's
It's
not that
not.
simple. And the first thing I learned from you was that the babies, you really shouldn't just be releasing the tongue. You should be releasing all the intertwine inside, because the essentially the tie goes down the whole fascial all the way down to
Connection.
the toes, because the tongue is connected to the toes. I had that, but I was almost shocked about all the releases I've done. I've never had them do osteopathy immediately or during. And it really shouldn't be done in the hospital by the doctor. It really should be done 3 to 4 weeks once they've gotten some fascial releases, because they have so much. And torticollis is more and more um,
Oh yeah.
common.
Yes, yes, yes. No. So I in my practice I train a lot of the parents how to release the intraoral structures, but they all go through cranio functional manual medicine, we call it in physical therapy, but it's basically osteopathy, um, to release the strain patterns in the head, and any of the twisting of the body and the pelvis and the spine. So get that all released, and have the baby balanced, and have their craniosacral system working well, and then do the release if they need it at that point. But not, I think too many people are going straight to it. But I think we are going to have another podcast on our book. That book, I would like to dedicate a little more time for that book.
Oh, that's a
Right,
good
Martha?
idea. That's a
Yeah,
great
let's do
idea.
that. Let's do that in the future. So no, but today was really, I don't know who's all going to be listening to this podcast, but I would love in the airway world to hear more that a dentist that's doing airway treatment is working with a functional person, either a myofunctional therapist that understands breathing, or a breathing retrainer that also has exposure to myofunctional therapy, or you create a team.
Yeah, a
But
team. But
it
you know what I've seen also, that before, some of my patients used to get bored with the myofunctional therapy, and I'm being very sincere when I say this, so that because they all wanted to do 1, 2 weeks and let's get the release done. I go, you really got a lot of torsions in your body. It's C2, it's C4, C6, it's thoracic 11, it lumbar, it really, and down to your toes. And then I even talked about, because I took a whole posturology program with an orthopedic surgeon. I was like, your arches collapse, and then your your foot goes like this, so you have a two compartment with an arch collapse. It's even my orthopedic surgeon is the one who diagnosed this one, came up with the theme and the thought behind all this. So what happens is your feet are telling me how much you are torsioned in the rest of your body. They're like, but I'm not. I said,
You're
this
not
is going to
aware.
show when you're 60 and 70 and you're going to be torsion. And that's what this is about. Do you want these torsions keep getting worse as you get older? Do you want your hips to grind differently and then you get a hip replacement? They're like, are you kidding me? No, I'm not. That's why all these things are really important. And you need a team. You need
Right,
to start
right.
breathing.
So
And
the
so
physical,
the ones with the breathing connected with the myofunction therapy are better patients.
absolutely, absolutely. But because I'm in Chicago and you're in New York,
Oh,
I
but
can
there's
do the
Zoom.
I can do the Zoom, Paul. I can do the Zoom. With COVID, everybody's learned how to Zoom, every day. But the hands-on portion, it is necessary to unwind at any age, right? People are so clenched and so, tight in their occlusion. And we're going to talk, another podcast is going to be around how the spine is affected by this clench that we've been, and the little project that I did about the aqualizer and how that released the pelvis. So that's in the works in our future podcast. But I do think that all dentists that are doing airway treatment need someone, and it's a team, right? You need a PT, an osteopath, a chiropractor, someone that understands the head and neck, the spine, to release all of the strain patterns, all the torsions. So sometimes they need myofunctional therapy, breathing retraining, PT, and sometimes they even need speech if they have a speech issue as well.
So you
Or
do it timely.
you've
You
been
do it
teaching me
timely.
about timely and sequencing, but also the eyes. You brought in the
Oh, the
eyes,
eyes. Hmm. The
right?
eyes are
So
really important.
sometimes they need eye therapy.
It's
And
really interesting because if I cannot get the posture on, they've done the myofunctional therapy, they've done a release, I've expanded them. The headaches have stopped, and these are kids, these are boys also. The headaches have stopped. So we've really worked with them already 9 months, but you can still see the torsion in their body. It won't release. The knee still internally rotating or their pelvis twisted and rotating. So then what I do instead of torturing them with, and I mean torture, because it's one thing after the other after the other. So what I do is I start with the eyes. I have them do vision therapy. As they do vision therapy, the posture starts releasing. And I teach the children of, to utilize that little exercise of the up and down, cross, side, and circles that I learned again through posturology, Dr. Bricott, because it releases the membrane tension in the brain, and it's almost like a reboot. A lot of top athletes coaches are doing that to their athletes now. They do a whole circuit, and then you see these athletes doing the eye reboot. It's a reboot, but it
a
releases
reboot.
the membranes.
Yeah, yeah. I believe it. I believe it. This has
And
been such a great.
we'll do a podcast, one eye and the other reboot is the one with the tongue. So you have the one with the eye reboot, you have the one with the tongue. You have to involve the vagal. It's a vagal reboot. We'll do one of those too.
Yeah, let's
Yeah,
do that,
it's
and maybe
fun.
interview a behavioral optometrist.
Woo! That'd be
That would
great.
be really great for everybody to just see how it all fits together. So we are almost at 30 minutes right now, Martha, and you know what? I think that this has been a great start to our podcast. I hope everybody's been um, learning something new and being exposed to what we're going to bring to you is more topics around airway, breathing, health.
And beauty. If you don't breathe really well, there's no way you're going to have symmetry of your face and of your body. Think of it.
You're so right. So we're going to bring in some aesthetics too, right, Martha? So, um, Thank you so much for your listening. This is Dr. Jennifer Hobson from the Hobson Institute and
Dr. Martha Cortés, New York City from Cortes Advanced Dentistry. Thank you.
wonderful. Till the next time, we'll hear and see you soon. Take care.
See you soon. Au revoir.